People I've been following for a little while, Dr. Psych and Styles, which means she's a psychiatry resident and style. So we are going online now. There she is. There you are. How's it
Hi.
going? What's up, Dr. Natasha?
Yes, I'm doing good. How about you?
I'm doing absolutely great. One thing I do want to do is just start off with introductions. So I've been letting people introduce themselves. So why don't you let the good people know the story or the one-liner for Dr. Ghambir?
One-liner, I am a psychiatry resident here in Austin, Texas. And if I was to introduce myself, I'd say super passionate about mental health, but
Mm-hmm.
also very geared towards movement. So healing through food, movement, and not just medicine.
Oh, yeah, that's right. We got a lot in common then for sure. Yeah. So I guess I'll introduce myself to your audience too. I'm Dr. Morrell. The Instagram handle is Doctor.Benergy. I appreciate you shouting that out though, Natasha. So I'm a lifestyle physician and confidence and life coach. So really, we're same background. I was a psychiatry resident for 2 years, so we had that in common. And then we sort of split ways, so I could start doing what you were talking about, is doing more of the lifestyle management stuff. So we'll dive right into that. So you are a third or fourth year resident now?
I'm going to be a fourth-year resident in about 14 days. Yeah.
Well, first of all, congratulations, and we appreciate your service. I know that COVID and the mental health game, mental health warriors out there, so glad that we have you.
I appreciate that. I do think it's getting better, even on the mental health side. So
Mm.
after it being a medical crisis, of course, there was a bit of a mental health crisis that came about. But
Mm.
I do think we're all headed towards recovery.
Hmm. I think it'll be a nice rebound actually, because everyone was separated for so long. There's always an equal and opposite reaction. Now people are diving into community stuff, health and wellness. So there will be a great arena for what you're about to be doing.
I really
So
hope so. I really
oh,
hope
for sure,
so.
for sure. So that one question. Let's see here. What did you do? Like, I'm just amazed by your ability to stay, as mentally and physically healthy and happy during residency as you are, especially during COVID. So I have to ask, like, what practices do you, knowing everything you do, what do you do to stay, mentally healthy through all that?
I would say I have like two big things that I stick to. I would say my number one thing is I make sure that, no matter how busy things get, I prioritize what I can control. So, of course, I can't control my schedule. I can't always control like where I'm working or what patients I'm seeing. But what I can control is that I, prioritize the fact that like whatever free time I do have, I use that to, get some physical activity in, see my loved ones, get the rest
Mm,
I need. So I really try to use up the space that's left
mm,
uh, to make it the life that I want to make it. The other big thing I would say is that the one thing that I've learned through residency, and for me, it's what's prevented burnout for me. My intern year, my fiance, who's also a resident and works way more than me,
mm,
we decided that like every like 3-4 months we would do something to spend time with nature. This is
mm,
like back in intern year. We kind of maintained that for the whole like 3-4 years, and built this sort of idea as like whenever we feel that burn on coming out, we're like the stories get sadder. And I'm not saying that for sympathy points. It's just that things got very sad through COVID, and then
for
we're
sure.
kind of witnessing it all. How
Mm,
do you heal from that? How do you not let that affect you over time? It's just like being in nature, healing, letting your body and mind recover, away from technology, away from the
mm,
stress, away from hearing the stories that affect you later.
mm. That's powerful stuff for sure. I think that the two things I'll just bounce back to you is your ability to separate what can be controlled and what can't be controlled is probably one of the main stems of I think anybody's mental health. And I've never truly sat down and thought about what I can and what I can't, or at least written it out. So that's a very good way to kind of box out or categorize in which environments can I complain and do something about it, or in which environments, or am I complaining for no reason and I had better just shut up and do what I was told, which I think is a lot of the the residency stuff that we had kind of had to go through. So first off, for anybody listening, I think for as far as mental health goes, that's an excellent strategy, and that's when I'll probably sit down and do that after we get off this, because we all want a little bit of control in our lives, right? And I think the second portion is having those interval breaks where you get to go out and do what you love. One of the most shocking facts to me who was just a hit your head against the wall, hardworking kind of guy back in the day, mind you. Never take breaks was my MO. And then I was reading the research, and it said people who take the breaks outperform people who don't. So I was like, you're telling me less work is more work, or you get more done. So I want to say, like, obviously you were ahead of the game on that and schedule it into your life. So strong work. And
yeah, I think if I looked back in my life, I don't think I implemented it very well early on in my life. I think I was one of those people that sort of put damage to her body pretty early on in undergrad, kind of pushing myself beyond my limits with like sleep or even like food, not really taking care of myself. And so now that I've learned the reward that comes with taking time off, and sort of like, it's a struggle to be like, hey, I'm not going to work. I'm not going to look at my computer. I'm going to let my colleagues cover me. Like, that's a hard thing to do when you're so passionate about your work. But in a sense, that's what's going to, like, getting away is going to help you heal.
And that's definitely that necessary time away, because I think we get stuck in that loop, where it's always work. And this was a problem I had in residency too, whereas, you come off of a 60, 80-hour week, and I'm just like stuck in it. And, whenever I distinctly remember going to the beach after my second month of intern year. And I was like, everybody I looked at, I was just diagnosing. Like, as they were walking by, I was like, that dude, that is for sure hypercortisolemia from a distance. And I recognize that essentially the danger of being in an environment where you're always looking at problems and solving problems is that becomes your mode of being. And I caught myself getting stuck in it, where I couldn't break. It was difficult to break out. But do you feel yourself like, so when you start your vacation versus how you end your vacation, how does your mind states change?
That's something I'd have to think about a bit more, like, for myself. But it just, like, off the top of my head, I would say that when it comes to taking time off, my advice to everyone is planning for it. So like, my next time off, even though it's like 4 months away, like, it's already planned. So it's sort of like anticipating your time off, and what that allows you to not, just have in the back of your mind is like, there's a little treat for you at the end of the day. There's something to look forward to. And it doesn't mean that you don't love your job. Like, I don't want to like, I'm like waiting for my next vacation. I'm not. It's just like, it's nice to think about time you're going to have off. And then that sort of like gives you, like, when you're starting to feel really burnt out or tired, you're like, well, I'll have a break coming. It's kind of like a good way to remind yourself that there's some kind of rest that's going to be available for you. And when you have to miss out on stuff, which is just part of medicine, it also reminds you that there'll be time for fun. There'll be time for other things in your life. So if you are planning ahead, that allows you that. So I think it sort of gives me that mindset. And then coming back off of time off, what I've like sort of like implemented in my life is like, I just prepare to get back in the game. So I give myself like one last day to just get everything together and just jump right back in. And that's just like, I think maybe that's a personality thing, but I feel like that helps me, because I can, like, the 2-3 days before, I can, like, prepare my mind to just dive back in.
That's really, really good tactics there, is an intentional time off. And this is something that I definitely struggle with coming off, where it's like, I always had that internal sensation, like I needed to accomplish something, there's always something I had to do. And then whenever I had time off, I was always stuck in between doing something and then not doing it, and then just feeling guilty about doing it. So I think intentional time off and then having those scheduled breaks, it gives us something to it creates a framework for how we can allocate our time, effort, and really resources. So they've actually proven this too, that if you tell people that, you know, you have 5 miles to go in a marathon, all that does is break their hearts, right? If you say, like, you know, just make it to that pole right there, make it to that stop sign, that short, visible, you can see it goal, pursuing those actually keeps people like very hopeful and very plugged in. Yeah.
Yes. So it's like it's a mindset of having like a break point. Yeah. So it's like doing a relay, right? We have like breaks where we hand things off, and that helps you. But it also, like, if you use your time off well, that's like to do things that are fun, but also getting rest in, and also, like I said, like for me, it's spending time with nature. Then when you come back in, you're actually excited to go back. And I know that sounds strange, but I was like, when I was done with vacation, I was like, I'm ready to get back in it. I'm ready to see my patients. And really, I feel like I can be a better physician and be there for my patients when my mental health is good. And that's just a reminder. I mean, I know there's people from different professions here, so I think it's important to like be inclusive in that sense. But like for anyone, like anyone who's serving people or helping people, when you're doing well, you become a better physician,
Right.
And you are able to sort of go the extra mile. So like, not only do I do a little bit of med management, but I also do a bit of therapy. But even just like with my therapy patients, like I see myself like more engaged and more wanting to really be there and listen to them and be in that moment. And I think that's different when I'm fatigued. So just wanted to add that in.
No, absolutely. And I think this is something that really got to me also during residency, was like being so tired during therapy sessions, and you're hearing somebody talk about things and like your mind keeps wanting to blank out. And I was so thankful for it, because it made me realize that, like, you know, Benjamin, in order to take care of other people, you have to take care of you first. And it really drilled that concept in, that I can't, the worst thing that I could possibly ever do at 3 a.m. on, you know, emergency psych was, you know, you have a suicidal patient. And if you go in there with a bad attitude versus a good attitude, like, you can absolutely shift the nature of somebody's life with a single conversation. So when you bring in your crap from, you know, yesterday or today or tomorrow into that room, you're not just ruining, you know, that patient, you're ruining everybody that patient comes across in the future, their family, their community. And it was really a call to responsibility for me to really take care of myself. And
that's a really good point, because just speaking of like the psychiatric emergency room in general, like you said, you're making a chain of difference. But the thing that comes in the back of my mind when I walk into one of those rooms, and I'm sure you experience this, is that this might be their very first impression of what mental health looks like. And they might have had like stigmas of what psychiatry is. And then I could either change that and be that person that listens to their story and what they're struggling with, or I could just fulfill all those negative stigmas that they've probably heard throughout their lives, depending on how I act in that room. So I think it's also important to remember that in like those situations, it's you're that first impression of what psychiatry is.
Absolutely. And I think that one thing that we have to do as people, especially in the mental health profession, is we have some repair work to do with the stigma and, you know, mental health and people who do it. Because, you know, there's obviously the social stigma about saying that you have issues with, you know, mental health, but there's also the stigma against mental health providers. So I was like, oh, they're gonna throw me in a, you know, inpatient rehab, or yank out my frontal lobes through my nose in a lobotomy, or, you know, perform unwarranted ECT. Like there's just like these horror stories about
big stigmas. But even like as little as just, say I have a new patient coming in, it could be as little as them thinking that I'm going to push medicine on them.
Right.
And then, you know, you being from a lifestyle background, I think of like someone who they might not be as afraid to walk in and talk, because they might not feel like you're going to be pushing antidepressants on them for them just feeling grief, or, you know, something simple. That's like not really MDD in terms of treatment plans. And so, you know, that idea of like coming to see me and having that stigma, depending on how I act in that encounter, they could feel like I'm someone who's going to be pushing medicine on them.
So how do you, whenever you're in an interview with somebody who is, you know, really, really struggling with that, because there's this whole like anti-pharma movement, the whole anti-medication movement. How do you balance that with the lifestyle stuff that you do also?
So I think it's important to have a conversation that I'm not for or against either. I go by what the evidence says, which is that a combination of both is really what is evidence based.
Yeah.
And then let them make the decision.
Right.
I like to think of myself as sort of the information giver, and giving them like the you know, maybe the benefits, or even like maybe the consequences that come with either one, or the time or the effort, and then let them kind of decide like what direction they want to go in, because, you know, I'm here to offer it all. If they want medicine, I'm here to do it. If they don't want it, I have so many other options for you, and I think that we share that, you know.
Yeah, I was like, this is what, it's funny but not funny, but I was like, so you're telling me you empower and educate the patient? Yeah. You know, the things that are not traditionally, they're recommended and advertised in medicine. They really are like, this is our goal. You know, it's part of the creed that we take, is that, you know, educate and empower. But we get so pressed for time that it felt like it turned into a lecture, and like, just listen to what I say so I can move on. And that part I really had to keep a good awareness of, and to make sure that, like, I'm not making these decisions for you as a patient. You are making them. You are the boss. You are your own decision maker. And I feel like empowering and educating, unfortunately, it takes the longest amount of time. So how do you sneak that in and amongst the rest of the psychiatric interview?
I have like this, and everybody has a different style, so I want to say that no style is wrong, but I like to just start out by asking them what they think is going to help them. Mm-hmm. And I think there's a bit of a cultural component to that. Like if you look a little bit at the cultural DSM versus like the traditional DSM, and for those who don't know DSM, it's like our manual that we use to diagnose and not treat, but just solely diagnosis, and it's not always accurate in that sense. But you look at the cultural version of it, which looks more at like different backgrounds and cultures and religions. There's a component that discusses like, sometimes what they think is happening, like a patient thinks that something is wrong with them, they have their own reason as to why they think that's happening. So I like to ask, like, why do you think this is happening, and what do you think is actually going to help? Because, you know, they might have an idea of what they think is going to help, and if they're just direct with me, I can tell them, yes, I can make this happen, or no, I don't have that in my power. And you know, I always, you know, don't always have that in my power. And then from there, I can kind of educate them and be like, well, I think A, B, C, you know, may help you. Let me tell you about them. And so I like to know what they're looking for before I start, like you said, going to like a lecture mode, you know?
Oh, so the first thing that you do is hop into their perspective and then get a sensation of their feelings. Did you hear me?
Yes. You got cut off. Can you repeat that?
Yeah, I said, so the very first thing that you do is step into their perspective and then try to experience what they're experiencing, and then also ask where they think it's supposed to go. So you're really putting everything that they're going through in context, huh?
Mm-hmm. And that allows me to like give options rather than like have my own perspective of what I think is going to make them feel better.
Oh, that's powerful, and I think that's true for almost any conversation. And you know, this is a lot of the work that I started doing, believe it or not, after psychiatry, was breaking down, you know, the principles of communication. And you know, the first one is, you know, rapport, trust, and really meeting the patient, the client, the person wherever they are. Because you know, if we're up here and they're down there and we're not matching up, then it's just the relationship is never going to work. So there's so much value in allowing them to speak at about a 70-30, 80-20 ratio, to where you can appreciate where they are, and then you match up, and then from there you can kind of create what you need to create and move forward. Is that an accurate? Does that sound about right?
I think that's very fair. Because yeah, you don't want to be that person that's giving them lectures of what you think is going to eventually help them. And I think it comes back to the idea of empowering and educating. That's more of my role. And I try to keep that in mind, especially if it's like their first, and like I said, I'm very careful when it comes to their first encounter with mental health, because everybody has their preconceived notions, whether they're good or not. And so kind of like making a plan together and working through it is ideal. Again, like you said, there's limitations like time, not being able to go through everything, but at the end of the day, it's all about partnering with your patient.
Absolutely. It's that relationship that it really gets it moving for people, where yeah. So how do you empower your patients? What's your strategy? Do you have like a go-to phrases? I call them like like truth bombs. You hit some people.
Truth bombs? Can you share one of your truth bombs with me?
Oh, for sure. So because very often people would come in after the loss of a mother, a father, or someone very dear to them. And I've actually straight up cured some people with this one, but whenever they have that as an issue going on underneath, and I would simply say to them, okay, so they went on some drug or alcohol binge for like 2 weeks and lost their job and everything. I'm like, okay, well, if your mother or father, loved one, were standing right there, what would they say to you? And their faces go like this, and they're like, oh no. And I'm like, oh yeah. Second thing, if you wanted to get out of this, imagine that person, the person that you loved, were experiencing what you're experiencing. What would you say to them? And then you pull it out of them, the exact solution that they need to save somebody that they actually love, with their own words and their own feelings, but it's mirrored back to them, and boom.
Sort of getting them out of the perspective that maybe they're stuck in, and getting them to see a different perspective of maybe a loved one that would have an impact. I see what you're saying. Yeah.
Absolute love. Just because usually after you've lost somebody, you forget about all the horrible things that they've done, and it's replaced with like, oh, I just miss this person, positive memories. So it seems to be pretty powerful stuff. But we'll generalize the question. Just what are like how do you like empower patients? Yeah.
I think for me, it's all about imagining and sort of that, like, this idea of like manifesting, and I know that's a simple word to use with what I'm describing, but that's the most accurate description I can think of. But sort of manifesting the life that you want to live. So where are you today? What is not going well? What is bringing on anxiety? What is bringing on depression? What are these symptoms? And shifting it to, what do you want your life to look like? What is missing? What is painful? What change can we make together so that you're functioning at a higher level than you are today?
So you take the visualization route, that's a really strong one too, and that you're drawing on people's natural understanding of their own potential. So one of my favorite things is like, you ask the patient, what are things that for a fact would make your life better right here, right now? And they'll rattle off like, 5 or 6 things, like I need to find a stable job. I need to get out of this relationship. I need to lay off the booze. And my next immediate question is, okay, what would you accomplish in 10 years if you were to keep those things up consistently? And they're like, probably would become whatever I wanted to be. And I'm like, yeah.
Yeah, and I think you're right. Part of it is just getting them to see the potential. Like I think you phrased it really well. Is getting people to see that they have so much potential, because when you're looking at the world, most of the time it's bringing you down with everything that's going around it, and you forget the potential that you have. And I think that's a big part of empowerment. Is empowerment is like giving hope that things can change. And when you've been pushed down from, people in your life or the world or events that happen to you, or trauma, most of the time trauma, then my role in that sense is to empower you to believe that there's possibility of life.
Do you, first of all, beautifully put. Second of all, do you ever utilize your own story whenever you have these conversations with people?
I think it is something that's quite controversial in our specialty.
Right, though.
Whether you should share your own story or not. I think a lot of the old traditional psychiatrists and psychologists have strayed away from that idea that sharing your own personal information, mental health, all that is just not recommended. But I think the new age of psychiatry is changing, and I actually feel pretty comfortable sharing with a lot of my patients that I've had my own mental health challenges, struggled with anxiety for most of my life since I was young, even as an adolescent, and have sought treatment, including medication, including therapy, and have gone to places where I've had to explain to loved ones and people who don't really understand psychiatry, especially in the cultural perspective, the benefit that I've gotten from it. And I think it does help in certain situations. I wouldn't do them in all situations, but there have been moments where, my patient and I are tearful in our encounter because we've connected in a way that we wouldn't have unless we shared those moments about our own background per se.
You're going to be a great psychiatrist, Natasha.
Thank you.
That is exactly the answer I wanted from someone who's going to be big in the field and leading the path for the next generation. Is like, everyone's watching. That's part about being sort of like on the influencer path, is that we're sort of setting a framework for other people to follow. And one of the biggest issues I had was the barrier between me and the patient, was why I struggled so much in systemized medicine, where, and I was guilty of this. I remember distinctly there was one time where, they wanted a PRN, like an immediate anxiety medicine for a patient. It was a child. And I just remember distinctly being like, I'm not going to do that. And I went back there and I brought my Native American flute, and I played my flute for like, I don't know, 3 minutes, 2 minutes. And, and then I said some kind words to her. She was sitting there all sad at first, and at the end she was smiling. And I was like, do you still need something for your anxiety? She was like, no, I feel all better. Thank you so much. And I just remember being like, you made you feel better. Remember that. And those are the moments that ultimately I cherished the most. And I had to start creating an environment where I could have more of those, which is hopefully what I'm doing now. And Anyways, there's my sentimental moment.
No, I think that's a cool story. It kind of makes me think, like, have we as physicians forgotten the power that non-pills or like non-pharmacological solutions, like words or love or just time can have? Do we sometimes forget that? And I think we do. I think sometimes we do, like, especially in like the ED, like. That's the challenge of
like cattle.
That's the challenge of being a good physician, is that you remind yourself that who you are and the energy you carry has, and the words you say have so much ability to heal. So much ability.
Yeah, that's like, so I'm really glad that you're leading that new wave and utilize that healing touch, and don't ever change, Natasha, unless it's for the better. Okay, the people need you out here. So I guess one thing is definitely, like, shout yourself out. How do we find you? How do we get a hold of you? Because I'm assuming you're probably gonna have your own practice or something along those lines. But I'm sure some of these people definitely on my list are gonna want to get a hold of you for some help. So.
At this time, I work in a private practice with my residency in Austin, and in the future, I have no idea where I'm going to be. But let's go ahead and let you share with anybody who's here how they can contact you if they're looking for confidence, for help with mental health, for anything and everything, because I looked at the profile list and it seems like you're there to help them through their life no matter what the need. So I go ahead and share.
Right. I really appreciate the political answer. Right now, it's still in residency. You got to keep professional and such things. So I can respect that. From my side of things, I'm out of that. So yeah, I'm just really trying to spread the good messages and provide all these ways that I really wanted to help people that I found, more valuable, which seemed to be just like true, honest, and open communication, and stabilizing the mind, body, soul through sleep, exercise, nutrition, consistent social interaction, and meditation and flow. And I just didn't feel comfortable going to the next level of medications and procedures and all these things until those things were addressed, because it bothered me that we were diagnosing some things as legitimate overt psychiatric pathology, like mental health illnesses, where I'm no, this person's strung out, burned out, and horrible nutrition. Once we correct those things and then they're still depressed, then we'll talk about throwing something in there to throw off their neurochemistry or and boost their serotonin. But until then, I just wasn't comfortable. So I had to
No, I'm glad there's people like you, because
Yeah.
I think we are shifting to overdiagnosing, and it's really, really important that we're addressing all the biocycle social spectrum of illness. So if it's just the fact that they don't have enough socialization, why not do that first? I agree with that concept before we go to a place where there's side effects involved and such. Now if they're struggling to a point where they can't function in life, then I'm here
Absolutely.
for them.
Absolutely.
Yeah.
Absolutely. All right. Well, we've been on here for 30 minutes and it feels like about 5. So first of all, it was a great conversation.
Thank you for having me.
Oh, absolutely. We'll have another one of these in the future, and we'll try to see if we can nail down a few concepts that you're interested in. Okay. Until then, you have a great day, doctor.
You too, doctor.
Bye now.